It's my pleasure today to give this presentation on generic versus branded antiretroviral drugs. These are my potential conflicts of interest. In this presentation, I will touch upon potential cost savings with generic antiretrovirals, review barriers to uptake of generic products, and discuss considerations for single-tablet regimens versus multi-tablet regimens for the treatment of HIV. Antiretroviral treatment, while being extremely cost-effective in terms of prolonged lifespan and quality-adjusted life years, nevertheless represents a significant proportion of financial costs associated with care. In the United States, antiretroviral therapy accounts for 60% of projected medical lifetime costs of HIV treatment, and total annual antiretroviral drug costs have doubled in the last decade, reaching over $22.5 billion in 2018. In Canada, a study at a single center showed a tripling of antiretroviral drug costs over 10 years, with most patients on antiretroviral treatment primarily on a single tablet regimen by 2017.